God forbid that when we open our churches and our various houses of worship, that we add to the number of COVID-19 cases. But it may happen and probably will happen. But here are some suggestions to help prevent that from happening. So if you want to have a copy of these suggestions, you can go to evelynmmaxwell.com and get a copy. In preparing the building for COVID-19, it's suggested, and most of these suggestions come from Karen Ball of the New Mexico Faith Community Nurse Network. So the building preparation, she says, should have professional cleaning. And I added that if there's vacuuming, sometimes you don't have available professional cleaning other than your staff. But if you're vacuuming, use a HEPA filter vacuum and face masks to be sure to help prevent you from getting unwanted dust particles yourself. Cushions and carpet, are they cleanable? Should they be replaced? Should the floor be a non-skid flooring to help prevent any accidents from wet floors? So the air conditioner and heating system filters need to be replaced. And before you open, we need to have general information on how many people plan to attend. And then draw a map, a seating map, and rope off the number of rows necessary to maintain a distance of 6 to 8 feet between them. This seating map is a document in the event that someone does come down with COVID-19 or show a positive test, and tracing might be necessary. So don't pass a registration pad. It's better to take a picture and keep that picture with the date so that further locating and contacting people will make it easier and more accurate. You want to limit the number of entrances into the building, and preferably have one way of entering and a different way to exit, if at all possible. If a rear entrance, you want to seat the people in the front of the building first, excuse the people in the back of the building first when leaving. And this way it reduces the number of times that people pass one another. If you have only one way to enter and leave, you have to figure out the best way to do that. You want to avoid using an elevator because of poor circulation of air and people's sensitivity to aerosol disinfectants. If an elevator is used, you want to provide wipes for the buttons and contact surfaces, and ask all of the able-bodied people to use the stairs to enter and exit. You want to seat people in family groups, seat them as far apart as CDC guidelines. I think that's currently 6 feet apart. And rather than shaking hands, you may have people greet one another by putting your hands together in a prayerful position and bowing to one another. I learned that when we were studying greetings in India. Search your sanctuary for non-cleanable items and remove hymnals, papers, or cards that might be routinely accessible. Replace them with electronic or individual printing or hymns, individual hymns as requested. Envelopes for giving should be mailed or distributed upon entering, or there are other ways to provide for an offering. Uh, you can have a place for them to put their offering when they enter or exit, and reminders about the distance to keep uh, between groups as you come in and as you leave. You can have offerings on a website. If you have a website, there's electronic deductions from your bank accounts and or your credit cards, and mail-in offerings also are a possibility. Singing, might want to dispense with that at the present time, or possibly consider a low volume chant to reduce the spread of particulate, in other words, the any virus, or just use instrumentals instead of singing or chanting. As far as communion is concerned for Christian congregations, those servings can be purchased in individual groups and given out as people come in to be taken at the seat when during the service. If you cannot get individual servings purchased, I suggest that when you fill the communion cups, that you leave all of the adjoining spaces empty, so that when someone reaches in, they will only touch one cup. Packets of crackers can be purchased and used and be distributed and consumed on the way out. Other items, snacks, visitation, you want to avoid them for the time being, or you could offer prepackaged purchase snacks. Have hand sanitizer available, but to keep from passing virus on the pump handle, you might want to consider having one person doing all of the squirting of the sanitizer, and have signs at your entrances and at your exits, in your classrooms, in your fellowship rooms, about social distancing, the distance to keep between groups. So these suggestions are especially for phase 3. Continuing to keep your distance and continue to use masks. Post-service cleaning, you want to wait at least 20 minutes after the congregants leave to allow all particulates to settle. The CDC lists several disinfectants that require 30 seconds to 2 minutes, but many of these have an acidic component. So consider the health of people and the use of sprays, and use masks. Fine furniture like your pews, they suggest just using moistened soapy water pad to clean and stroke all in one direction. Don't go back over the area that's been cleaned, because then you'll drag contamination backwards. One of the things that I wonder, and I'm not sure whether it would work or not, is to have large cotton bed sheets to cover the pews between the congregants and wash between events to help reduce the amount of cleaning required. So again, if you want to have a copy of these suggestions, which we hope will help reduce any spread of COVID-19 among worshipers, you may go to evelynmmaxwell.com. That's Here's to You Health, one of the many Here's to Your Health websites. And so you have to be careful that you go to evelynmmaxwell.com, and you can get a copy of these for your congregation to use. Many blessings. This is a message from Holistic Health Information Education and Evelyn Maxwell speaking to you. May God bless you and keep you safe. Showers of blessing we need. Mercy drops round us are falling, but for the showers we plead. Showers of blessing we need. Mercy drops round us are falling, but for the showers we plead.